you've been on the path to wellness for a while, but your doctor is still looking for ways to improve or decrease your risk for cardiovascular disease, or maybe you've been doing everything right when it comes to food choices and yet your blood levels are still showing elevated markers for inflammatory conditions or cholesterol levels, or maybe you're just looking for a way to increase your wellness and prevention game. Either way, it might be time for you and your doctor to take a look at your mouth as a source of inflammation. In this video, I will show you one thing you can do for your health that will keep your mouth and body healthy. That one thing is the use of an interdental brush. Hi, I'm Dr. Lauren Roper, a general dentist in Western Colorado with an interest in oral systemic health. I started my practice a little over a year ago because I wanted to be able to teach patients about the life-saving prevention of disease and the connection between the mouth and the rest of the body. People say that their parents had bad teeth and they believe that is the reason why they themselves have decay or periodontal disease. This is true, but not just because of genetics. It is because of the transmissibility of bacteria that cause the disease and a predisposition to inflammation. Yes, genetics play a role, but dental disease, heart disease, and most other widespread chronic systemic diseases are preventable no matter what your genetic makeup is. Also, the prevention of dental disease and heart disease can be accomplished simultaneously. Remove the source of the inflammation and you regain and maintain health for the whole body. I am personally invested in this topic because I have a family history of heart disease. My grandfather died in his early 50s of a sudden heart attack. I know that because I am genetically predisposed to heart disease that I need to make good lifestyle choices and do everything in my power so that I can live a long and healthy life. A couple of years ago, I had unfavorable results on a carotid intima media thickness test, which led me to take my health and food choices more seriously. A carotid intima media thickness test, or CIMT, is an ultrasound of the carotid arteries in your neck. This test will tell you if your arteries have any plaque or calcifications, and also if your arteries are aging faster than you are. My test revealed that although I had no buildup in the artery, that the thickness of the artery wall was actually equivalent to that of someone 13 years older than myself. This is pretty alarming for me because I consider myself to be healthy, fit, and active. So I began to take my diet more seriously and really focus on whole plant-based nutrition. I had dabbled with vegetarianism in the past, but had never really committed myself to complete wellness. I reread the China study and rewatched Forks Over Knives, both of which I had been exposed to before, but just hadn't taken the leap and really committed myself to complete wellness. It's so easy for us in our daily lives to not see how our daily food choices can affect our overall health, because most of the time we feel okay. If there's anything that I have learned and can pass on through my experience, it's that we need to test and not guess. So often the first sign of a problem is a stroke or a heart attack, or in my arena it's a tooth loss, and then the damage is done. It's unfortunate that so many of these diseases continue to progress silently until it's too late. But the good news is that all of these diseases can be prevented if we as doctors do our jobs to test for the early stages of disease, emphasize prevention, and talk boldly about it. I have been asked to recommend a daily habit change that is easily attainable but also greatly impactful. While my habit change is not about the food that you eat, it does start with your mouth. I realize that we as dentists tend to beat our patients up about not using floss to the point where they just want to avoid the dentist at all costs. Interdental brushes like these, this one is called a soft pick, is a great alternative, especially for people that have trouble with dexterity. The truth is that floss is a great tool, but if it's not being used properly, it's not nearly as effective. Floss needs to be wrapped around all sides of the tooth, whereas something like this is three-dimensional and can really get into those spaces and do a great job at removing plaque, but stimulating the gum tissues as well. So why do all of this? What is periodontal disease, and what is the link between periodontal disease and heart disease? Periodontal disease, also known as periodontitis or gum disease, is an inflammation of the gum tissues and a loss of bone, the bony structure that holds the teeth in place. There are two stages to this. It starts with gingivitis, which is the precursor to periodontitis. So gingivitis is purely inflammation in the gum tissues where you might have red, swollen gums and bleeding gum tissues when you floss or brush or eat. And it's a totally reversible stage. When you continue and progress into periodontal disease, periodontitis, you actually have loss of bone and loss of attachment of your gum tissues to that bone. The reason we are emphasizing the importance of this is because the bacteria that cause periodontal disease are now known to be linked to heart disease and many other chronic diseases as well. So here's a quick demonstration of how to use the soft picks. I've got a model here for you to see, and this is what the soft pick looks like again. Again, we've got these rubbery green bristles that are going to grab all of that plaque and really massage your gum tissues and stimulate the capillaries that are in your gum tissues. So what you want to do is take the pick and you're going to put it in between the teeth like that, in those spaces between where your gum and the tooth is. And you want to push until you feel some kind of push back on the teeth. And then if it comes out without a whole lot of bleeding, you can move to the next site and go to all of those areas in your mouth. I would say if you do get to a space where there is a lot of bleeding, you want to switch to a new brush so that you're not spreading bacteria from site to site. The other thing to note is if you feel like you've got a space where this green size isn't really having a lot of pushback, if the space is too big, you can look for a different size. So the brand that I'm showing you here is called Soft Picks by Gum. They sell these two sizes, but you can also ask your dentist if neither of these are working for you. Ask for a different recommendation on a type of brush. So what is the connection between oral health and heart disease? In November of 2016, Drs. Bradley Bale and Amy Doneen published an article in the British Medical Journal describing new evidence between periodontal disease and heart disease. They showed that the bacteria in the mouth that cause periodontal disease not only places at higher risk for heart disease, but the bacteria can indeed cause heart attacks. There are many signs and symptoms of periodontal disease that you can look for at home that include bad breath, loose teeth, bleeding gums, or a change in how your teeth fit together when you bite. However, as mentioned before, some infections can be present without any symptoms. Before your mouth reaches that tipping point of inflammation and bleeding gums and bone loss, it is possible to test for levels of bacteria that are building up silently. Test, not guess. Your dentist can test for bacteria in your mouth that are known to cause these inflammatory conditions of periodontal disease and heart disease. It is non-invasive and a simple salivary test where you spit into a tube and send it off to a lab. Ask your dentist for a thorough periodontal assessment and a salivary DNA test. Prevention truly is the easiest course of action. Remember, seeking a course of prevention is much more cost-effective than treating active disease. Your health and wellness are an investment that will pay off for a lifetime. Also remember that there is no such thing as just a little bleeding. Blood in the urine would be cause for great concern, and likewise, so should bleeding gum tissues. A cut on the hand that refuses to heal would be addressed immediately, and likewise, so should bleeding gums. I wish you great success in your continued health journey. If you have any questions, please feel free to reach out to me at roperdds@gmail.com.